Hey guys, so in today's video, I thought that I would respond to a post that was actually in a medical assistant group that I am a member of on Facebook. So I want to read to you what this post said, and it's more of a question than a post, like it's not a statement, and I want to share my thoughts. So this post said, as medical assistants, we all have our unique preferences and passions within the healthcare field. What specialty do you prefer working in as an MA and why? So, for those of you who don't know, I have worked in a few different specialties as a medical assistant. Um, at the hospital that I worked at, we kind of covered in a bunch of different areas. So, I have worked in internal medicine, I have worked in family medicine, I have worked in urgent care, and I have also done some coverage of different shifts for dermatology, pediatrics, and orthopedics. So I will say, out of all of the different settings that I've worked in, my most favorite would have to be the urgent care. So I do like family medicine. That would be my number two, but my number one would be urgent care, just because, like, while I do like my routines and I like to kind of have everything set in place, and like I like to know, from the beginning of the day to the end of the day, how many people we're expecting. And that's true with family medicine. Like in urgent care, I really like the fact that you can see so many different things in just one shift, and you don't really know what's going to come through the door on any given day. So I really do like covering those urgent care type shifts. And most of the time when I covered those shifts, I was on the weekends, although sometimes when my provider would be gone when I was working in the clinic full time, I would end up covering in our walk-in clinic, which is urgent care. Um, so I just really enjoyed, like, not knowing exactly what's going to come through the door, not knowing exactly what's going to be wrong with a certain person, what types of testing we're going to have to do, being able to experience a whole bunch of different things in just one shift, or all of the same things. Like, there were days when it's like everybody was coming in for a sore throat, so we were doing a lot of rapid strep tests and things like that. Or we would be testing for COVID or doing respiratory viral panels to test for COVID, flu, and RSV. Um, I just really liked that. And some days it would be totally chill where you wouldn't have that many people coming in, whereas other days it would be kind of, there's no time to sit down because you've got 8 people showing up at urgent care at the same time, and you don't really have time to sit down because you have to see everybody and make sure that everybody's taken care of and checked in and provided the care that they need. So I really liked working in urgent care the best. I did really like working in family medicine, like I said, just because it allowed me the opportunity to form strong relationships with my patients. And like, knowing a patient when they come in kind of seems to make them feel more comfortable having that relationship with you. And I just really liked seeing the same people coming back. Like, there were certain people who had chronic diseases or conditions where they would come in on a monthly basis or every 2 weeks or something like that. And so to see the same people repeatedly come in and be able to form that relationship and bond with them, I really, really liked being able to do that. You don't really get that as much in urgent care. I mean, you do tend to have your frequent flyers, especially when you're the only urgent care, like within a certain space or area. So you do see the frequent flyers, but it's not as consistent as if you are a family medicine practice. I did like internal medicine as well for a couple of different reasons. Sometimes it's nice to take a break from having to deal with pediatric patients. Not that I don't like working with pediatric patients, but sometimes it can be really tiring to, because they require a different things than adult patients would, or like having to do vaccinations and things like that. Like, I hate making babies cry, and so that would be like one of the least favorite of my appointments coming into family medicine, would be like a well child check where you've already checked their vaccination records and you know that they're due for a whole bunch of vaccines. I hate making the babies cry. Like, The kids are not as bad. Like, I don't like making them cry, but the babies, when they're all so happy and, they're smiling and giggling at you and all that, and then you bring in these needles and, you make them cry. Like, it just makes me so sad watching a baby just go from super happy and bubbly and laughing and giggling and, all of that stuff to crying their little hearts out because you just stabbed them in the leg with a needle to give them a vaccine. Not that, I think that vaccines are wrong, because I don't, but yeah, it's just sad, like making a baby cry. So I would definitely say that I prefer to work in urgent care. Like I said, if you work as a medical assistant or even as a clinic nurse, let me know what specialty you prefer to work in. What specialties have you worked in? So, like, there are a couple that I would like to work in at some point, if I continue to work as a medical assistant. For those of you who don't know, I do currently work as a sleep technologist. But I'm also PRN as a medical assistant. So, like, I've kept my other medical certifications active. So I currently have certifications as a CNA in multiple states. I have 4 different states active right now as a CNA. I have a national medical assistant certification, a national phlebotomy certification, and I'm currently working on getting certified as a sleep technologist. So that's all in the process. But anyways, let me know what specialty you prefer to work in. Is there a specialty that you prefer not to work in? Like, I feel like I would not really want to work in OB-GYN because I just like the different procedures that you have to do in OB-GYN. I would not want to do that on a daily basis, I don't think. I don't mind doing it like in family medicine because it's not something that you're doing basically all day, every day. But I feel like in OB-GYN, it would be done pretty much at least once a day, like PAPs and things like that. So yeah, that is not really my cup of tea. So I would choose not to work in OB-GYN if I had my way. But yeah, anyways, let me know, and let me know if there's any other topics or questions you have, and I will do my best to get something filmed for you. And with that being said, I will talk to you guys next time.